The American healthcare system has long been the subject of political tug-of-war, but few policy shifts have had as immediate and personal an impact on the average citizen's wallet as the recent executive actions by former President Donald Trump, as he returned to office and began rolling back healthcare provisions enacted under the Biden administration. The financial shockwaves started to ripple, not just through Medicaid and ACA participants, but through insured and uninsured communities alike. It all began with a series of executive orders that may not have garnered as much media attention as some other headlines, but which carry consequences that could reach deep into every American's bank account. Trump's actions weren't just administrative shifts, they directly targeted the very programs that had, under Biden's leadership, expanded access to healthcare, subsidized premiums, and introduced experiments to lower the cost of essential medications. While supporters argue these rollbacks are about curbing government overreach and restoring fiscal responsibility, the reality is far more complicated and far more expensive for millions of families. To understand how these changes hit your wallet, we need to start with the foundation. What was working under the previous administration? During President Biden's term, sweeping changes to the Affordable Care Act, ACA, and Medicaid expanded eligibility, increased subsidies, and extended enrollment windows. These reforms allowed a record number of Americans to access affordable insurance, and many benefited from lowered premiums, expanded coverage, and protections that went beyond traditional medical treatment, such as Medicaid-covered housing, assistance, food programs, and even climate-conscious health interventions like providing air conditioners to low-income families. These benefits weren't handouts. They were part of a comprehensive public health strategy that acknowledged how interconnected economic status, living conditions, and health truly are. But almost immediately after resuming office, Trump set about undoing many of these policies. For example, he rescinded an executive order that would have allowed Medicare to test out a program offering $2 copays for certain generic drugs. Though this initiative was still in its trial phase, the idea behind it was powerful to make essential medications more affordable for people with chronic illnesses like diabetes, heart disease, and high blood pressure. The rollback doesn't just kill the test, it symbolically slams the door on efforts to bring down prescription costs through government intervention. That single decision reverberates outward. If you or someone in your family is managing a long-term condition, you know the price of staying healthy is often measured in monthly prescription costs. Without reforms like Medicare drug negotiations, those costs continue to climb, and in some cases become unmanageable. And this isn't a theoretical concern. According to data from the Kaiser Family Foundation, nearly 1 in 4 Americans report skipping medications or cutting pills in half to make them last longer. Without relief from skyrocketing drug prices, more families will be forced into these dangerous cost-saving decisions. But it doesn't stop there. Trump's directives are also scaling back the Medicaid expansion Biden had aggressively pursued. Under Biden, states were incentivized to offer broader benefits through Medicaid, including support for non-traditional health needs like nutrition, mental health care, and housing instability. The idea was simple: prevent health problems before they happen by addressing root causes. Trump's rollbacks, however, prioritize a narrower interpretation of Medicaid as a strictly medical program. This narrower scope will likely strip away those expanded benefits, leaving millions of Americans with reduced access to care. And it's not just other people who rely on Medicaid. The program covers 1 in 5 Americans, including children, seniors in long-term care, people with disabilities, and working families whose employers don't offer health insurance. What happens when Medicaid is scaled back? Fewer people qualify. Those who do may lose access to previously covered treatments, and the ripple effects reach the broader healthcare economy. When uninsured or underinsured patients show up at the ER with advanced health problems they couldn't afford to treat earlier, those costs are absorbed by hospitals and passed on in the form of higher prices to everyone else, including people with employer-provided or private insurance. This is what economists call a hidden tax. When healthcare costs are shifted to insured patients, premiums rise, deductibles climb, and out-of-pocket expenses become harder to manage. If you've noticed your health insurance getting more expensive while covering less, policies like these are part of the reason. Another target of the Trump rollbacks is the ACA marketplace itself. Under Biden, the ACA had seen record enrollment. By lengthening the sign-up period and boosting subsidies, the administration ensured that millions more Americans could afford marketplace insurance plans. Trump's changes threatened to undo that. progress by shortening enrollment windows and narrowing eligibility, meaning fewer people will be able to access subsidized plans. If you've ever had to shop for health insurance on your own, you know how overwhelming and expensive it can be. Marketplace plans often offer the only affordable option for self-employed workers, freelancers, or those between jobs. And if you miss the enrollment window, you're stuck without coverage until the next year, or forced to pay high premiums. For limited short-term plans that offer minimal protection, the economic fallout doesn't end with the individual. It stretches to employers, particularly small businesses, who often rely on ACA subsidies to provide affordable insurance options to their employees. Without them, those costs rise, and businesses either pass them on to workers or drop coverage altogether. Then there's the psychological toll. Healthcare insecurity doesn't just create financial stress. It diminishes productivity, increases mental health burdens, and disrupts family life. If people are constantly worried about losing coverage or affording medications, they're less likely to take risks, change jobs, start businesses, or pursue education. The fear of a medical emergency without insurance keeps people locked into unsatisfying jobs, discourages entrepreneurship, and stalls economic mobility. Let's not forget either the way these changes disproportionately affect marginalized communities. Low-income families, people of color, disabled Americans, and those living in rural areas are all more likely to rely on Medicaid or ACA plans. Cutting these programs widens existing inequality and leaves the most vulnerable even more exposed. So, what can you do about it? First, be proactive. Take the time to review your current health insurance plan. Understand what's covered, what's not, and what deadlines might be changing due to federal policy shifts. If you're on Medicaid or using an ACA plan, stay informed about your state's marketplace. States often have flexibility in how they apply federal rules, and local programs may offer support even if federal ones shrink. Second, don't underestimate the value of community-based healthcare resources. Nonprofit clinics, health departments, and advocacy groups often step in when federal programs are rolled back. They provide access to screenings, vaccines, and even specialist referrals at low or no cost. If you're facing a coverage gap, these programs can offer a critical lifeline. Finally, the host urges viewers to consider the bigger picture. Healthcare policy isn't just a political issue, it's an economic one, a family one, a community one. When fewer people have access to affordable care, everyone pays more, sometimes with their wallets, other times with their health. As executive orders quietly reshape the healthcare landscape, the public's role becomes more important than ever. Staying informed, speaking out, and sharing personal experiences can help push back against harmful changes. Policies may start in Washington, but their effects show up everywhere: in the pharmacy, in the doctor's office, in monthly premium, bills, and in emergency rooms across the country. Trump's rollback of Obamacare-era provisions isn't just about undoing his predecessor's legacy. It's about rebalancing a system that was finally beginning to bend toward wider coverage and cost control, and shifting it back toward corporate interest and restrictive access. Whether or not that's a sustainable or humane direction is up for debate, but one thing is certain: it's going to cost Americans. The question is how much, and whether we'll fight to stop the meter from running higher. Let us know your thoughts in the comments. Has your healthcare coverage been affected by these changes? What's your experience navigating insurance today? Don't forget to like, subscribe, and hit the notification bell, because healthcare is one policy battle that touches every one of us, whether we're ready or not.